102.9 W4 Country and Move. It's Luke Bryan, 840 in the Breakfast with Bubba show in the morning. Trying to bring you the best information that is available during the stay home, stay safe, save lives. I want to make sure I got the governor's
That's
phrase
correct. You got it.
That was it. We have State Representative Lana Theis from Michigan's 22nd District on the phone. Good morning, Lana.
Good morning, State Senator. I've been upgraded, but
I'm sorry.
That's okay. That was my title previously. But if they're trying to find me, they're going to have difficulty if they Google representative.
Okay, State Senator. What do you need to tell us this morning?
Well, first I wanted to start out by hailing the heroes in all of this and saying thank you, because one of the things I found when I started staying home was that I was getting depressed. I was spending all my time on the internet, looking at the numbers, getting frustrated, and then I decided, that's it. I'm getting back to all that exercise equipment I have in the basement. I'm going to get started that way, and I tuned in to W4 Country first thing in the morning, and hearing your voices, which I always hear on my drive time, just completely made my day and perked me up. And so I wanted to tell you guys, thank you. I have to assume that's true for an awful lot of people, and I want to recommend to the people who are listening right now that they get to that sort of a thing. Focus on your health instead of focusing on the negativity. It kind of reminds me of the days after 9/11 when we were all so soaked into what was going on on the cable news channels. We couldn't get away from it. We were hoping for all these things that weren't going to happen, and we ended up just getting completely depressed. We need to refocus. We will get through this. We will come out better and stronger. But right now, we just need to focus on getting through it and focus on the health of ourselves and our family and our communities and how to help. And you guys are a huge part of that. So I wanted to say thank you. I wanted to focus on the doctors. They are doctors and nurses and the people who are working in our medical communities right now. They are in dire need. Not only are they heroes because they're going to work every day knowing that this virus is a chance that they can get it, and they have families at home too, and they don't want that either. But they need face masks, they need face shields, they need gloves, they need gowns. They've posted, most of the hospitals have posted what it is that they need, but there's a shortage. They only had 1 to 2 weeks supply on hand. And then the international supply, or the national supply, was drawn down during the SARS epidemic and apparently never built back up. So we're not getting national shipments to the state, which I'm sure people heard if they heard the governor speak. But we're trying really hard to make sure that they're being provided for in this, and they are people are recognizing that they're heroes in this as well. Teachers, I chair the Senate Education Committee, and our teachers are going so far above and beyond right now to try to educate the kids. And our school districts have gone so far to make sure that the kids have either technology or paper in front of them in order to be able to learn. Teachers are reaching out to individual students to make sure that they have that ability. What I'm hearing, the stories I'm hearing from across the state are just amazing to me, and I want to lift them up and tell them to keep working at it. In spite of what the director of the Department of Ed said, that it won't count, please understand that the legislature and the governor are working together to do our best to make sure that we can get all of our kids over the hurdle, and all of your efforts are absolutely being recognized. I can't say what statute we're going to be able to change in the process, but we are most certainly going to do our best to make that happen. The Department of Ed director actually has the ability to issue seat time waivers right now through innovative teaching, and he chose not to do that. So, but as a legislator, what I want to make sure I'm doing is a thoughtful approach to handling our students. So I'm not just going to throw something out there and say we're going to ignore the rest of the school year, or we're going to pretend like everything they've learned so far is complete. We're going to try really hard to make sure we're educating to the best of our ability, and we don't want to fall to the lowest common denominator. If it's just something we can't do for everybody, so therefore we shouldn't do it for anybody, that's the lowest common denominator. We need to do our best for everybody possible, and for anybody that we're not able to do that for, we need to reach out and make other accommodations and make sure that we understand that those people weren't weren't able to be accommodated right away, and so we're going to make sure that we handle any issues that they might have, whether it's that they don't have internet or that they can't learn by that methodology, but we're going to do everything we possibly can to make sure that those kids get taught. I know I'm kind of monologuing here, but I want to thank you for the opportunity. There's so much that I wanted to say.
Oh, I appreciate the monologue.
There's
Yes,
so much to
Yeah,
say.
there's a lot to
Absolutely.
say. Yeah. Now, is the legislature? Are you guys even able to meet? How are you getting things done with the social distancing?
We are under law allowed to meet. However, if you think about it, there's 110 representatives, there are 38 senators, and there's all of the support staff between policy and in our offices that go along with it. So it vast outnumbers what is recommended by the CDC at any level. So, for example, my staff is entirely working remotely. Where the calls are being forwarded. If anybody calls into my office, which if you want to, is 517-373-2420. Emails are being answered. Emails are SEN, like Senator, L. Theis at senate.michigan.gov. We are absolutely at work right now handling an awful lot of questions. The primary question that we're getting right now is my business and considered necessary, and can I go to work? Because a lot of the information that was put out, but with the governor's order, the directive wasn't as clear as they would have liked to have had it, or maybe their business. One of the questions we have, for example, is a home builder. People are in the process of building their homes. If their homes aren't built, they don't have some place to move into when their lease ends, and they don't have a place to live. Houses seem like an absolute essential. So are the construction workers, therefore, essential?
And I think what's leading to part of the confusion too is what's essential in one state isn't necessarily essential in Michigan. And I'll use an example similar to what you just said. Real estate is considered essential in Ohio, but in Michigan, it's got to shut down. Like real estate sales, Michigan doesn't consider essential. Ohio considers that as essential. So I think we're getting mixed messages, especially because of where we sit geographically. Some people in our listening area get their news out of Ohio. Some of them get it out of Detroit. Some get it out of Lansing. It's just this mishmash of messages that everyone's doing their best to clear up. I know that.
And our order was kind of a hybrid of Ohio and Illinois with a little bit of Michigan wrapped in. So you're right. There are mixed messages, and that's happening around the country. And then even from the same source coming out, we got different sources coming from the federal guidelines with respect to what to do about education. This is unprecedented. We're just going to need to have an awful lot of grace as we come through and understand that nobody else has dealt with this either. And while I can armchair quarterback and say a lot of this should have been contemplated previously, it wasn't. So let's move forward. Let's figure out how to get this done, how to solve it, and move on. I think in the tail end, we're going to have an awful lot of good that comes out of this because we're going to find there are a lot of things that we didn't know we could do that we can. And then it's going to create a lot of technological innovation that we didn't have before and a lot of medical innovation that we didn't have before. I was online yesterday with a doctor who's looking at stem cell treatments as a potential solution for this virus. And they're not even in trials with it yet, but he's trying to find a way.
That's awesome.
So,
it's amazing how everyone's just getting together and trying to do this. We know in New York that big. What is the name of that drug, Welch, that you had in that?
Chloroquine.
Chloroquine.
Yeah.
That big study is starting today in New York. Like as of today,
That could be huge.
They're doing the chloroquine and Z-Pak combo to a lot of patients to see if we can get some actual news that this is officially working to knock this virus down and tamp it down a little bit, which I think everybody wants, and I'm 100% sure we'll get to.
I am also 100% sure. I know they are in human trials with a lot of different vaccines as well. Well, I shouldn't say a lot, a few different vaccines in different countries as well. But we're trying to get the treatments through. What I would I would warn people about is don't try home treatments that you think are the same.
Right.
They're not. Make sure what you're doing is interacting with your doctor. If you feel like this is a problem for you, go get tested. Perhaps you need to first verify whether or not you have it, and then deal with the doctor and get the treatment from them. Don't try to self-medicate on this without interacting with your doctor first.
Exactly. I saw somebody suggesting on social media yesterday to drink tonic water.
No, come on.
Because it has quinine in it, which is...
oh, jeez.
Like, no, tonic water is not going to keep you from getting coronavirus. Tonic water may make you feel better about being at home if you mix it with something else.
You got to put something else
in it, but it's not going to do that. I'm sorry, I didn't mean to cut you off.
That's all right. You and I think, discussed previously, one of the things that I did want to mention was with respect to the numbers going up so dramatically. Initially, when we started doing our testing, we couldn't keep up with the number of tests. We could only, as the tests were coming in, they could only process a little over 100 a day. We're way over that now. We're over 1,000 a day right now because they brought on commercial labs and some private labs to do the work as well. So a lot of the tests, the positive tests that you're hearing about, are people who were tested days ago, maybe quite a few days ago, and weren't necessarily terribly ill, but they were suspected. So they're most of the way, or at least halfway through the major symptoms that they're dealing with in this virus, and they're getting to the recovery period. But the numbers are escalating just because the test kits results are coming back, not because the infections are going up quite as dramatically as they look like they are. So we shouldn't be panicking ever anyway, and we should absolutely heed the governor's order. But I just wanted to put things in context for people.
Awesome. Thank you so much for being generous with your time this morning. We appreciate it so very much, and just know you're always welcome on the air here.
Mm-hmm.
Please have people reach out. I gave my telephone number and my email. I also sent you a copy of my card so that you can put that information online. There's opportunity. There's economic disaster relief. There's grants. There's loans. The economic impact is going to be huge. For people who have questions or who need help, please have them reach out to me, and we will direct them to the right source in order to try to help them out.
State Senator Lana Theis, thanks for joining us.
Thank you so much.
Appreciate it.